Hey Barbells Barstool Nation, this is Justin coming at you with the weekly update on Insure to Insure. Part 2 of the healthcare coverage conversation today. Last time we talked about what the deductible is, what the max out of pocket is, etc. Today we're going to be talking about a copay, and we're going to be talking about the two main types of plans that you'll see out there, an HMO versus a PPO. Starting with the copay, a lot of plans that you see out there will either have a $25 copay for your primary provider, maybe a $100 copay to go see a specialist, something along those lines. Basically, a copay is what you pay for the service. So if you don't have a copay and your doctor bill is $200 and you haven't met your deductible yet, you're going to pay that $200. Whereas if you have a copay of say $25 on there, that's all you pay out of pocket is the $25. However, that does not count towards your deductible or max out of pocket cost. The second part of this is the HMO versus the PPO. The HMO being the health maintenance organization and the PPO being the preferred provider organization. Benefits and pros and cons, I should say, to each, but basically an HMO is going to be less expensive. However, you have to stay within your network of doctors for it to be covered. A PPO gives you a little more flexibility for a little more cost. You can go to whatever doctor you want. The other thing, big difference between them, would be referrals. Generally, to go see say you have an allergy problem and you need to go to a specialist in that, you'd have to go to your primary provider first and get a referral to go outside of your HMO network there. Whereas a PPO, you don't need a referral, you can go straight to the specialist, in this case for the allergies, that whatever you may need covered, you can go and see them for and not have to worry about being within your coverage range. HMOs are a little bit more popular in the city, just a lot more higher concentration of doctors and everything right there. So I would tend to recommend those if you're living in a more populated area. Absolutely still check to see what kind of providers and everything are out there to be covered so you don't have to go without insurance or have an unfortunate situation where you find there's nobody in your network around you. Definitely something to check on. So today we covered copays and HMO versus PPO plans. Be sure to follow us, listen to our podcast rolling out on Thursdays or some special edition ones. Thanks for taking a look at us today. Hope you guys have a good one.